Well, thanks so much. I think it is so fun that we have this session where we each get to stand here and gesticulate a little bit and talk about what we are so excited about in our own work, where we think we really have the opportunity to meaningfully transform healthcare through one specific or an approach or a specific strategy. I'm going to talk today about the move home. The move to deliver more and more care at home. And sometimes it's the most innovative things that when you sort of peel back the onion, those most innovative things are things that happen naturally 200 years ago. And in some ways, this, what I think is such an incredibly innovative new way of delivering care in the United States, is a throwback, but it's a throwback with a lot of bells and whistles, and ideally, I think, if we get this right, could be a critical way for us as a country to deliver better care, more patient-centered care, more cost-effective care, to deliver better outcomes, to reduce costs, and to fundamentally change the way we deliver healthcare in this country. So, in the words of a very wise man, healthcare is complicated. And there are a lot of features to the kinds of care that our patients get, that our members get, that our family gets. And it is not entirely intuitive at first glance which of these features, which of these facets can be given at home, should be given at home, are appropriate to be given at home. But as you take a further look and you start to really peel back, it becomes increasingly clear what the options are. And in fact, we're not starting from scratch. The rest of the world has figured out how to do this. I go away on a business trip for like 2 days. I come back, on my front porch is at least 18 boxes from Amazon. We have an incredible system now in retail where my family, sometimes me, generally not me, in our family, make purchases that are very, very personalized. The data is used to drive incredibly thoughtful, targeted recommendations to my wife, to myself, sadly to my daughters. And it works. I mean, we do not leave the house to do most of our shopping right now. Our shopping happens in a very efficient, consumer-centered way. Similarly, when I get movies these days, my movies come to me. I turn on the TV and Netflix has some analytics that has apparently watched or has considered the shows that I've watched in the past, makes a variety of really, really thoughtful suggestions about what I'd like. And Netflix tells me what I'm going to watch next. And in fact, that is exactly what I do. I watch what Netflix tells me to watch, and they're right. They're consistently right. They recommend the right show. The day of my going to Blockbuster down the road, or the day of my, even on a regular basis, going to the movie theater down the road, has really diminished because I can get a very personalized, very high quality, and incredibly convenient service in my home. So let's think about it in terms of healthcare. Increasingly, where do we spend our dollars in healthcare? We spend our dollars taking care of our patients, our members with complex chronic conditions. Some have complex medical conditions, others have behavioral health concerns, some have concerns about social needs and their social context. There's a variety of sort of barriers to one's health that any patient may be experiencing. But more and more, we're realizing that that is something you can determine far better if you visit the patient at home. And if a patient has a chronic condition, do they really need to come to the physician's office to check their blood pressure if we have a blood pressure cuff at home? If we have the ability to check a blood glucose at home? If we can get labs done in an outpatient setting and we're able to follow a patient carefully at home? In fact, as we're thinking holistically about how we care for our patients and understanding what their true barriers are to better health and better care, aren't we thinking about what we do for them at home even differently? Are we thinking more about understanding their social context, understanding whether or not they're food insecure, understanding whether or not they're socially isolated, understanding whether or not they have appropriate transportation to get to the doctor's office or to get to some social event that's going to be really important to keep them engaged in the community? Are they getting the necessary kind of behavioral health support to address any behavioral health issues? It really speaks to the fact that when you get in a person's home and you understand the context in which they live, you have a greater opportunity, far greater than you ever would in a clinic, to really understand who that person is, to really, really understand them as a person, to holistically address their needs, and to fundamentally take the requisite steps to alter the trajectory of their health. So we're thinking about this in a variety of different ways. First, we're working hard to define the care that's best delivered at home. And we're not going to do hysterectomies in the home. There's a bunch of things we're not going to do at home, but there is a lot of very sort of standard, low-risk, easy procedures, easy data collection, easy interactions that we know we can do at home. We increasingly have to leverage data in the same way as we're seeing in retail. We have to leverage data to better understand the needs of our members. We have to understand their preferences. We have to understand their changes in behavior and how that will help us to anticipate adverse events or to symbolize that they need proactive care to keep them on the path of being healthy. They need motivation around how to participate in healthy lifestyle, adherence to their medications, activation in terms of engaging with members of the community. That sort of that data infrastructure that allows us to really understand, interact with, proactively support, and react to our members will be critical. And increasingly, we're going to have to develop the future workforce. Today, we've made an investment in Kindred at Home. So Kindred at Home has about 50,000 home care providers. We also have Humana at Home, has a large number of nurse telephonic care managers. We have an enormous staff of folks that can either telephonically or on the ground visit our members in the home. But we think this is just the beginning, and to be able to really create the right set of professionals that can really help our patients is at the core of our ability to be successful. So first of all, in terms of the opportunity, when you ask seniors, where do they want to get their care? Overwhelmingly, they say they want to get their care at home. They want to get their care at home because it's convenient. They want to get their care at home because they can get help with their medications and all the complexities that are in their house. They want to get care at their home because they believe that care will be more affordable, not just because they don't have to pay parking, but because a home-based care should be a lower kind of copay. We should be able to arrange something that is more affordable for our members. And it should be more enabled with technology. As we are collecting information from our members at home, as we're collecting information from data in their claims, as we're collecting information from their electronic medical record data, we should be able to create a much more holistic surround sound approach to really understand who our members are and to be much more progressive and provocative and proactive in terms of how we reach out to them. The other thing is our members want this care to be personalized. They want it to be easy. They want it to be seamless. If they need something, they want to be able to press a button. And we're seeing that in virtually every other line of business. Retail for sure. In healthcare, it is essential that we have that same kind of seamless way of engaging the healthcare system. And it has to be personalized. That it can't be this anonymous interaction. The person that you're talking to at the company, for us at Humana, needs to know not only why you're reaching out, but needs to know your medical history, needs to know who your primary care doctor is, needs to know if you've been in the hospital last month, needs to know what is going on with you so they can have a thoughtful, fulsome conversation about how to help. So we're working hard in terms of this workforce of the future. In fact, we just started a medical school at the University of Houston. We funded a medical school that focuses on creating a curriculum around value-based care. We're teaching doctors to think holistically, as their core mission, to think holistically about managing populations. And we're doing so within a context in which there's a college of social work, a college of pharmacy, a college of nursing, a college of optometry. And the function of the school is to make sure that all of these schools spend time together. And that the output, a successful output is a team-based approach, one where social workers know how to work with nurses, know how to work with doctors in a way that everyone can work at the top of their license, everyone knows how to communicate, and everyone knows how to build a better system for managing patients. And ultimately, this all works only if we can integrate all of these solutions. So we at Humana, we own a large home care business. We own we own the nation's largest home hospice company. We have a pharmacy benefits management company and a pharmacy. We have a lot of primary care. We have a behavioral health company. But all of that is useless if we can't integrate them. The only way that we're going to ultimately be able to take these great strides in terms of understanding who our patients are and deeply intervene, deeply understanding them and really creating the right intervention for the right person at the right time is to be able to integrate all that data, integrate the folks that are taking care of these patients, and working together to come up with the best possible solution for that patient. It means using data and using AI that allows us to connect information about what they buy at the grocery store, what they buy at the pharmacy, and whether or not they, they adhere to their medications. Did they buy another pair of running sneakers? Are they exercising? Using information in the home to get a better sense of the amount that they're sleeping or awake, or we get more information about who they are to get a sense of their performance, their experience, and how we can better support them. And ultimately, here's where we are. We're trying to accelerate this process. We're working hard to create this ecosystem through data interoperability. None of this works unless our data can connect, our data can interact. We are working hard on the science to make sure that we know what are the right interventions, what are the right touch points, what are the right channels of communication, what are the right messages that we can ultimately use to drive better health, better behavior, better outcomes for our members. And last, we cannot do this in a fee-for-service model. This must be accomplished by thinking holistically about where we fit in a value-based framework, how much risk we can take or are willing to take, how do we think about what we're willing to carve out and say is our own in the care of patients in the home, and ultimately those deeper partnerships with risk-bearing providers, risk-bearing health systems, risk-bearing primary care docs is going to be the key structural sort of decision around how we're really going to drive better outcomes, better experience, and lower costs. We're really excited about this work. We're excited to work with all of you about it on this too. Thank you.
Thank you, Will.